If you or a loved one is experiencing extreme appetite for human flesh, stiffness of muscles, blurry vision, decaying flesh, accumulation of flies, extreme body temperature changes, or trouble walking, then you might have contracted the zombie disease.
Hi, I'm Dr. Yarbrough. I'm one of the main doctors here at the ZDC, Zombie Disease Center. We have recently discovered that this new apocalyptic disease is caused by the bacterium called necrotizing fasciitis type Z.
Necrotizing fasciitis is commonly known as the flesh-eating bacteria. The bacteria has evolved and has found a way to quickly enter the bloodstream, giving it access to the heart and the brain. Normally, necrotizing fasciitis eats the flesh of the host, but type Z is much more brainy. It has found a way to enter the nerve cells to control the electrical impulses, allowing for it to bring someone back without being completely alive. Type Z influences all brain activity, forcing its host to have a cannibal appetite, so that it will consume other humans. Necrotizing fasciitis then feasts on the consumed flesh. All zombies are contagious. Extreme zombies are the most contagious because the bacterium is spread throughout the body. The infection is transferred through contact with infected wounds, bites, and scratches.
I have diagnosed many patients during this apocalyptic time as a zombie, commonly known as a walker. There is no cure for this clever bacterium, but there are several precautions, including:
do not travel at night. Do not carry too much weight. Stay silent when walkers are near. Do not come in contact with infected zombies' wounds. Always stay at a safe distance from a zombie. Be alert and prepared to run for your life. Be aware of the different zombie stages. And lastly, the best way to stop a zombie is trauma to the head. The zombies include pre-stage, stage 1, beginner zombies, stage 2, intermediate zombies, and stage 3, extreme zombies.
A pre-stage zombie is not someone who is already dead. A pre-stage zombie is anyone infected by either sickness, scratches, or bites. During this stage, the patient develops a fever, extreme sweating, redness, fatigue, and coughing blood.
My name is Carol Johnson, and I lost my son to the zombie disease. It all began that day when he came home from school. He complained about stiff muscles and about he had a headache, he was kind of dizzy. So I sent him up to bed to get some extra rest, maybe because school's stressing him out or something. But then all that night, he was vomiting and coughing and he was running a fever. So when I went to check on him the next morning, that's when I noticed it. The bite mark. It was on his hand in plain sight. It was all red and swollen. So I rushed him to the hospital, and as soon as we got there, they took him to another room and they needed to do some tests on him. But I never saw him again.
Beginner walkers are zombies who have not been transformed for less than a day. After 8 hours during this stage, lividity becomes permanent. There is greenish-purplish skin decolorization. New zombies walk slowly because they have extreme stiffness, known as rigor mortis. During this stage, rigor mortis is from the head to the neck. Within the first 2 to 3 hours, film forms over the eyes. Because the zombie is newly transformed, they have less decomposition compared to older zombies, which means that autolysis begins and will progress over time. These zombies have a slight odor of rotting flesh, slow reaction to noise, and have a strong craving for human brains. Intermediate walkers are zombies who've been around between 2 to 12 days. Rigor mortis is completely gone after the second day, so these zombies can speed walk. These zombies have a strong odor because their flesh has had a lot more time to rot. Also, blisters form, the bodies become bloated due to gas buildup, and stomach contents are released. Stage 3 is the last stage of the zombie. At the end of this stage, the zombie will die because the bacterium will starve due to lack of decomposing flesh to feed on. During this stage, the rotting flesh and hair begins to fall off the body. The eyeballs also liquefy. Because the bacterium cells are starving, they have an appetite for any type of flesh. Therefore, these zombies will spring quickly after humans due to desperation, and they will devour any type of human flesh, not just brains. There are several factors that affect decomposition, such as temperature, insects, illness, clothing, weight, and sun exposure. Heat causes slower rigor mortis because if the temperature is hot, then the body will take longer to cool down. Heat also causes faster progression of rigor mortis because the heat causes a chemical reaction which, in response, the cells break down faster. So the calcium breaks down, causing stiffness to lessen. Heat also causes faster livor mortis. The heat causes a chemical reaction, so the cells break down and seep into the tissue, so lividity occurs faster. Cold causes faster rigor mortis because the cold temperatures cool the body quicker. This also causes slower progression of rigor mortis because the chemical reaction then takes longer, causing rigor mortis to last longer. The cold also causes slower livor mortis because the absence of heat makes cells take longer to break down and seep into the tissue. When one dies, insects use the decomposing body for food and a place to reproduce. Blowflies are usually the first to arrive at a dead body because they are attracted to the rotting flesh. Beetles show up once the body is drier and more decomposed. For beginner zombies, insects lay eggs within the first few hours, which develop into maggots and larvae. For intermediate zombies, the blowflies go through 3 instar stages and begin the pupa stage. For extreme zombies, the insects go through the pupa and adult stage. If someone was ill when they died, they will decompose faster because their immune system was already weak, so their cells break down quicker. Warm clothing causes slower rigor mortis because this creates warmth. This warmth also causes faster progression of rigor mortis. Little clothing causes faster rigor mortis and slower progression of rigor mortis because cool clothing allows the body to lose heat quicker.
When a person is larger, they have more fat cells, which means autolysis takes longer. Rigor mortis is slower because the cells will provide warmth longer. Bigger zombies will also have slower rigor mortis because there are more cells to break down to end the stiffness. There are opposite effects for smaller zombies because they have less cells.
When a zombie is exposed to the sun, rigor mortis will take longer, and there's faster progression of rigor mortis because the body is warm, so the cells break down faster and flesh decomposes quicker.